Welcome to another episode of the Most Serious Podcast. And today I have a person who's made a transition in professional career, which I think I personally haven't heard of before, and is super cool in my opinion. So I have Dr. Vishesh. Thank you so much for joining us on the Most Serious Podcast, Dr. Vishesh.
Thank you so much, Ritu, for calling me over here. It's a pleasure to be here, and it's always fun to have conversation about what's happening in life and what is there in the world happening. So, thank you so much.
And it's fun to always be a part of these conversations as well. And I think this podcast truly, and this is what we were talking about before recording as well. I think this is one medium of expression that I truly like about podcasting in general. And personally for me as well, I feel to get access to these conversations personally and then to distribute them to a larger audience who listens to this show gives you that sort of, I don't know if it's education, but I just feel it's an experience which people would miss out on. So most people wouldn't have access to getting a conversation with you or hearing you talk about your personal life, and I think which is super interesting. But through the medium of podcasting in the past couple of years, how it has picked up, I just feel that it allows so much more knowledge to be distributed in a non-constructive way, which I feel is really good for people.
Yeah, great.
Do you listen to podcasts?
I listen a lot. I am a big podcast fan. I've tried my luck in creating podcasts.
Okay.
So it is a fun journey. I understand how interesting it is to listen to people and to talk to people. And being a kind of person जहाँ पे मुझे लोगों से बात करना पसंद है या सुनना पसंद है, so that is always fun. So whether it is Spotify or some other podcast channel, or I listen a lot of podcasts on YouTube as well.
Yeah.
So this is a good journey for me. And a learning experience.
I think now you should add the Most Serious Podcast as well to your list.
Yes, for sure. I would actually love to do that.
Yeah, so I think let's start to the most coolest bit where which I find about you, and I think most people certainly do, is this transition from being a doctor to being an entrepreneur. Like, how does that happen? Did you have an inclination towards business? So are you an entrepreneur who mistakenly became a doctor first, or are you a doctor who then realized that he's an entrepreneur?
So actually both the things are correct. One ways. So post my MBBS, I did my MBA in hospital administration. So getting into administration was always my thing. My family was or is into hospital business. So I've grown up being in a family where I've been seeing my parents and my uncles into administration and doing business related to healthcare. But I always wanted to be a doctor. One, so doctor banna to destiny tha. Getting into entrepreneurship was into my genes, and from the management side of a hospital, getting into a personal entrepreneurial journey where I started this venture of my own. So that was one thing which happened. And I think it was meant to be like that, because I have realized one thing, that this is much more fun and adventurous journey, and I'm enjoying this part of my life better than if I would have been a doctor myself, like doctor as a clinical practicing doctor. So yes.
For some reason, I feel that doctors, and so, see, this is a perspective of me looking outside in from that for that industry, but I just feel that the connotation that doctors or that industry has for becoming a doctor, it just kind of people think of that as a limiting in a limiting capacity, because that is the reason why we don't have so many doctors turning into entrepreneurs or just making career switches. Like we see that in tech, we see that probably in different industries where people pivot a lot. But for doctors, because the amount of academia that you have to go through and you have to rigorously just be a part of that journey, so I just feel that limits them into exploring other territories, which you were able to do. But do you think that's correct? Like, because of that academic pressure, many people who maybe might have wanted to do something else outside of being a clinical doctor just have to limit themselves.
So, Ritu, I'll tell you one thing. If you would have seen the majority of the hospitals running in the country are being run by doctors itself. So leaving apart the corporates of the world, the Apollos, the Shalbys, and the rest of them, but if you see general hospitals, they are run by a doctor itself, who is the founder of that hospital. So कहीं ना कहीं वो they
Hmm.
are doing their entrepreneur way as well. So switching the thing from healthcare, I should not say healthcare, but the clinical side to a non-clinical side, it has become a really common thing nowadays.
Okay.
Many doctors are realizing that there is a lot of adventure in the non-clinical path as well. And अब बहुत सारी चीजें open हो चुकी है. जब से ये स्टार्टअप का चीज लोगों के जहन में आया है कि देयर कुड बी मल्टीपल ऑप्शंस और अपॉर्चुनिटीज व्हिच आर देयर अदरवाइज डूइंग द क्लिनिकल थिंग. सो उससे लोगों को एक राह मिल गई है. दे हैव स्टार्टेड फाइंडिंग सम वेज दैट ओके दिस कुड आल्सो बी एन अपॉर्चुनिटी एंड दैट कुड एक्चुअली लीड टू अ लॉट ऑफ मनी एज वेल. सी एट द
Hmm.
एंड ऑफ द डे एवरीबody इज वर्किंग टू अर्न मनी, right? To earn a good livelihood. That is the whole objective. While you were doing clinical practice, then also you tend to earn money, but a lot of efforts is required in the clinical thing as well, and a different kind of efforts are required in the non-clinical part too. You were talking about the academia part. I totally understand कि आपने पूरा MBBS के 5 साल दिए, फिर उसके बाद PG किया, सुपर स्पेशलाइजेशन किया, whatever. You have spent good 10-12 years in the study life. But if you talk about the non-clinical, or I should say the entrepreneurial journey which I am living, so मैंने जो पढ़ाई किया वो मेरे लिए बहुत आसान हो गया टू अंडरस्टैंड द स्टफ आउट हियर. इफ आई वुड
Hmm.
हैव बीन अ डॉक्टर, मेरे को यहाँ पे मेडिसेवा रन करने में उतना इजी नहीं होता, क्योंकि नाउ आई अंडरस्टैंड द पर्सपेक्टिव ऑफ अ डॉक्टर. आई अंडरस्टैंड द पर्सपेक्टिव ऑफ अ नॉर्मल पेशेंट और अ नॉर्मल ह्यूमन बीइंग. So I am living the both side of the way. So it is easier for a so I call myself as a medipreneur, medical entrepreneur. So it is easier for me as a medipreneur to understand the both side, or I should say the all the side of the plate. So that's the
Yeah.
thing. एंड टॉप ऑफ इट ये इस जर्नी में एकेडेमिया मेरा यहाँ पे भी खत्म नहीं हुआ है. आई वॉज नॉट अ टेक पर्सन, आई वॉज नॉट अ फाइनेंस पर्सन. आई एम अंडरस्टैंडिंग टेक, I am doing all the finance in the company as well. So making from getting the balance sheet done to all the P&Ls to all the books maintaining and the futuristic projections, everything. So I'm learning every day. I'm learning so many new things. So
Yeah.
my academic thing is still going on, and I think वो किसी के लिए भी होता ही है. So every day you learn something. You are meeting so many people on your podcast, so you are learning something new every day with them as well. So वो academia तो कहीं ना कहीं otherwise भी है. You're not reading books and you're not giving exams, but you are studying, you're learning. So मेरे लिए तो that is more important. That learning should continue. वो learning किसी भी perspective पे हो सकता है. Yeah.
आई थिंक मेरे को हमेशा से ये चीज़ तो आई ऑलवेज वंडर अबाउट दिस दैट हाउ डॉक्टर्स व्यू एंड यू नो यू आर अ पर्सन हु आई थिंक हैज़ विजिबिलिटी इन टू बोथ साइड्स ऑफ द कॉइन यू बीइंग एज अ डॉक्टर एज वेल एंड हैविंग दैट विजिबिलिटी ऑफ योर ओन वेंचर इन द हेल्थ केयर इंडस्ट्री. What is the status of Indian healthcare when you compare it to the rest of the world? Where does India rank in terms of general healthcare access to across the population, if you were to say, and not just limited to some segments? How does India
So
fare in that?
दो तीन चीजें बोलता हूँ.
Yeah.
The quality of healthcare is equivalent to the quality of healthcare which we get in any other country of the world, any of the first world country. Our healthcare system, the doctors out here, everything is at par with the facilities which we get outside India. The majority of the doctors, if you go to USA, so people say that we want to go to US to get our treatment done. So the doctors treating over there are also Indians. If you're going to UK to get the treatment done, the doctors over there are also Indians who are treating you. So the mind, the brains are the Indians. They are the most smartest fellows who are actually running the healthcare system across the world. So that's one thing. Two, if you talk about the masses, I really understand that it is definitely not possible to reach out to each and every possible individual of this country. India is humongously huge. The size of population which we are having is, we all know that it is now we have surpassed China and we are highest in the world. And for a government where our economy is not that great in terms of what we see in the European countries or China or the US, so in that comparison, we are really working really good. हम लोगों का healthcare system has developed a lot with the advent of multiple healthcare startups or the healthcare policies which the government has come up with. Things are changing drastically day on day. The For us, if I talk specifically
Yeah.
for us, me as Medyseva, founder of Medyseva, so the telemedicine thing which has come into play, the telemedicine guidelines issued by Government of India has actually helped to reach to the bottomest of the pyramid where it was difficult to reach otherwise. So coming back to what you asked, that how far at what level are we in terms of reaching to the individual, to each and individual. So my final answer would be that it will take time. It is not day's job that हम लोग ने कुछ चुटकी बजाई और हम लोग वहां तक सबको सब कुछ पहुंचा पा रहे हैं. So our economy doesn't support us that much. But then also the way the government is working in enhancing and supporting the individuals, it is great. Yeah.
No, I think you are Mediseva, from whatever research that I was able to do. I think it's a very noble cause, and the target that you are going for, and providing all of that access in rural areas, and in areas which are not as privileged, we don't have access to medicine or healthcare to that level. And I think it's a very noble cause. But I also want to touch up this topic with you, which I've always heard anecdotally, and my dad always talks about this a lot. That see, there are a lot of illnesses, and there are a lot of medicines for these illnesses, but he talks about like if you were to go 50 years back or 40 years back, people led very simple lives, and maybe it was undiagnosed illnesses, and maybe no one ever came to know that they had a problem, and then they just passed away or something like that. But do you think there is something to play with our lifestyles that is causing too much focus on healthcare? Because there's this quote that I don't know if you might disagree with this, but there's this quote that a healthy person never thinks about health in that regard, because health always comes on your mind when you start feeling something sick, or you see something is off, then you start caring about your health more. What's your take on this?
So I'll break down the answer into 2-3 parts.
Yeah.
So first, answering to what your dad has told you. So 30 years, 40 years back, what was the average lifespan of an individual?
Probably, I don't know. I think, but it again increases or not. I think 6, 70,
No,
80. Yeah.
no, it was 60 years.
Okay.
55 to 60 years was an average lifespan for an individual. Now, what is an average lifespan? That is somewhere around 80 years.
Okay.
Okay. So earlier, when the healthcare was not that advanced, and people, I agree that they used to live simple life, but they were not able to diagnose what problem they were facing. There were not enough medication to support their illnesses. So that was the reason that people used to die at an early age, and that was okay with the people. That okay, 60 साल का हो गया, अब तो बहुत बुजुर्ग हो गया, अब तो कभी भी जा सकते हैं. Now 60 years is no age. 60 years is pretty young. They are fit and fine. Why they are? Because now people understand that this is the way the people have to live. The lifestyle has to change. You have to do a lot of work to maintain your lifestyle, your health, so that you can live a good, prosperous life for a good 80, 85, 90 years. So that is the objective which every individual is trying to achieve. सी एक वो भी होता है कि 80-90 साल जीना, बट बेड रिडन होके जीना, या
Quality
80
of life.
साल जीना
Yeah.
और उस पे मतलब आप फिट होके जीना. सो दैट आर टू डिफरेंट थिंग्स. सी अगर मैं फिट होके रहूंगा तो मैं बहुत अच्छी लाइफस्टाइल जी सकता हूँ, बट अगर मैं 70 साल में बेड रिडन हो गया तो मेरी लाइफ क्या बची? So that is the reason you have to be really fit. You have to do a lot of exercise. You have to control on the food. You have to check for all the cleanliness and every kind of things. Then only you can sustain that kind of lifestyle till the end of your journey.
I think how someone, I was probably talking to a friend who is pursuing their MBBS or something, and they come from a family of doctors, and they told me this about doctors, that doctors are the doctors are the people who underdiagnose them to their last extent of thinking that this is under control and this is under control because of the fact because of the nature of their profession. Is that true? Like doctors are lenient with their health and maybe overly concerned with their patient's health.
Yes, it happens. Generally it happens. कई लोगों के साथ, खास करके जो थोड़े पुराने डॉक्टर्स होते हैं उन लोगों के साथ होता है, बोले अरे हाँ ये तो ठीक है, ऐसे ही है, कुछ नहीं है, कुछ नहीं है, कुछ नहीं है, दे ट्राई टू अवॉइड. बट अगर मैं न्यू एज डॉक्टर्स की बात करूं, इवन इफ फॉर मी, मेरे को मुझे पता है कि अगर मेरे को जरा सा भी सर दर्द हो रहा है, आई विल टेक अप द पिल इमीडिएटली. आई वोंट वेट, बिकॉज मैं नहीं चाहूंगा कि मेरा उसके कारण मेरा दिन खराब हो और मेरी प्रोडक्टिविटी डिक्रीज हो. ठीक, पहले एक नॉर्मल वो होता है कि अरे अरे अभी कंट्रोल कर लो, देखते हैं ठीक हो जाएगा, चाय पी लो, कॉफी पी लो, ऐसा लेट जाओ, सो जाओ, ठीक हो जाएगा, ठीक हो जाएगा, यू शुड अवॉइड द पिल. बट जो भी न्यू एज डॉक्टर्स है ना, इफ यू टॉक टू देम, दे लाइक कि पॉप अप अ पिल, यू विल गेट बेटर एंड एटलीस्ट योर प्रोडक्टिविटी विल इंक्रीज. आपका दिन बचेगा, दिन भर में बहुत कुछ काम कर सकते हैं. अदरवाइज मुझे माइग्रेन है, सो अगर मैं नहीं दवाई खाऊंगा तो इट विल लीड टू माइग्रेन एंड मेरा दिन और अगला दिन दोनों खराब हो जाएगा विद अ सिंपल हेडेक, अगर मैंने उसको वहां पे कंट्रोल नहीं किया. सो आई एम गिविंग अ वेरी बेसिक छोटा सा एग्जांपल, बट दिस वेरीज. मतलब कोई भी नहीं चाहता है कि उसको डिले करे, प्रोलॉन्ग करे इलनेस को. इमीडिएटली उस पर असर हो जाएगा तो बाद में कोई प्रॉब्लम नहीं होगी. और ये भी एक एटीट्यूड है, बाद का अगर कुछ बहुत है, कुछ प्रॉब्लम है तो बाद का बाद में समझेंगे, बट आज तो सॉर्ट आउट हो जाएगा.
बट ये
पर्सपेक्टिव से बोल रहा हूँ.
I want to, yeah, again, I think the last sentence is very important, that you're saying this from a doctor's perspective, but I just want to understand from a common man hearing this, because you are speaking it, so they might start implementing in their life as well. How safe it is to take a paracetamol or a crocin, I think these are the most, or Dispelling or things like a medicine like these.
Is the safest possible drug.
And like people should take it once they start feeling some symptom of a cold or a fever, or should they try to prolong it and see if their body recovers?
Yeah, I would say that they should take it because वापस मैं उसी के लिए बोल रहा हूँ कि they'll feel more comfortable. अगर तबीयत ठीक नहीं है, so none of the individual can actually do anything good for themselves. It is just hampering their own personal life and hampering the others who are associated with them. So, and talking about the paracetamol otherwise as well, it's a very, very safe drug. There is no side effects to it. And ऐसा नहीं है कि हाँ दिन में 10 गोली पॉप कर रहे हो, obviously, तब problem है. But once in a while, there is no harm. There is genuinely.
I think because there's so much talk sometimes that experts' advice and opinion just gets missed in that all of that noise. So maybe someone, if they were to consume 10 reels on Instagram telling your lifestyle is bad, your this is bad, that is bad, that is bad, and because controversial advice again really sells, so someone saying stop taking crocin at all, that reel will probably go viral, and you are spoiling your liver just by taking crocin. Maybe that goes viral, but a doctor saying okay, it's fine if you have a cold, maybe you take it once in the morning, once in the night for 2-3 days, you'll get fine. But that is boring advice, right? That doesn't sell on the internet. I think
एडवाइजेस का तो मैं एक चीज बोलता हूँ. पहले कैसे होता था कि मेरे अपने पेरेंट्स के टाइम पे, मेरे पेरेंट्स तो आपके पेरेंट्स से ज्यादा बड़े ही होंगे, बड़े ही हैं श्योर. तो उनके टाइम पे ये था कि घी खाओ, घी खाओ, घी खाओ, घी बहुत अच्छा होता है, बहुत अच्छा होता है. फिर देन देयर इज अ टाइम केम, घी बिल्कुल नहीं खाना चाहिए, तो कोलेस्ट्रॉल और पूरा हार्ट और ये वो. अब अगेन दिस थिंग हैज कम अप, यू कैन ईट घी, देयर इज नो प्रॉब्लम विद घी फॉर योर हेल्थ, राइट? So there are phases to stuff. जब क्रोसिन बनी तो अरे क्या ड्रग आया है, हमारा लिए तो जन्नत हो गया, हम तो अब परेशान ही नहीं हो रहे. So you start popping. अब फिर एक आया, कोई एक महानुभाव आ जाते हैं, ये बहुत खराब है, लिवर खराब कर देता है. अरे लिवर खराब कर देता है, खराब करता है, बट आप वो समझो, वो भी बताओ साथ में डिस्क्लेमर, जब आप दिन में 10 गोली खा रहे हो, रोज खा रहे हो, तो खराब हो रहा है. So rather than just giving this is unfortunately the era which we are living in. It is the era of influencers. So influencers जो बोल जाते हैं लोग बाग सुन लेते हैं, और influencers की एक responsibility बनती है कि सही चीज बताओ. If they are onto that way, so they have to give a disclaimer कि भाई मैं ये बोल रहा हूँ तो इसका reason ये है. Either justify with certain books, certain information which is available across, जिसके papers publish हुए हैं. मैं एक ये it's not only a paracetamol but there are so many drugs, there are so many things which come up. So उसको कोई back करने के लिए उनके पास कोई statement होना जो कोई authorized body से आया है, then they should do it. अभी क्या होता है ना कि random बोल जाते हैं, बोल गए अरे ये तो बड़ा आदमी है, वो इसने बोला है तो इसको तो हमको सुनना ही पड़ेगा. बड़ा आदमी बनाने वाले कौन? आप लोग खुद ही हैं. आप ही ने उसको इतना प्रमोट किया कि वो बड़ा आदमी बन गया है with no knowledge, and there are so many of them. They're not even one. I don't want to name any of them, but there are n number of them who give shit advice, which is not backed by anything, and they're just doing it by their own virtue.
I think this really should be promoted more, and I feel I'm really glad that you've come and said this so openly, because sometimes whenever there is a person who's on the edge, right, so they have a tendency to get onto any extreme, and most of the population really lives in the middle, and they're very easy to influence, and I think two motivations for any influence is fear and some sort of greed. So they are at play at everything. So whenever you strike fear in someone's mind, and maybe health is one of the biggest things that someone fears, like this might go wrong if you might start balding if you have this, or your height might decrease if you start doing exercise, or things like that. So I think that fear plays into people's mind and really restricts them from having an open mind or having an open discussion about these things.
So इसी के लिए पता है यही चीज इन्फ्लुएंसर्स कर रहे हैं. इतने खराब रील्स बनती हैं जिसका कोई औचित्य नहीं होता है. there's no science behind it, but they just go and blabber it out. And जो masses, what you rightly said, जो masses है जो मिडिल में अटके हुए हैं ना, उनको लगता है ये रियलिटी है. कुछ रियलिटी नहीं है. Are there doctors who are going and saying this? No. The general public who are coming and blabbering anything. उन्होंने कहीं पे उन्होंने भी कोई रील देखी, जो रील देख के उन्होंने आगे बोल दिया. So आप भी एक किसी का बकवास स्टफ है जो आपने अपने आप को ग्रहण किया और वही आपने आगे आके ब्लैबर कर दिया. तो एक बहुत अच्छी चीज तब होगी then, but like the kind of things what you were trying to do is doing podcast.
Yeah.
Doctors on board. If you are a great influencer, talk to them, bring them on board and talk to them that मैं बोलता हूँ ये सही है कि नहीं है. बताओ सर, आप बताओ, मैं ये बोल रहा हूँ पैरासिटामोल खराब है कि ये नहीं है, खराब ही है ना, एकदम खराब है ना. अरे यार क्यों खराब है? शांति रख, समझ. अगर खराब है तो कब खराब है वो? तो that has to be seen.
I think account, ये चीज आपने बहुत इंटरेस्टिंग बोली. वैसे पता है, we never hold people just giving unsolicited advice accountable for their advice, because
there is no law in the country ना. no law in the country कि आज विशेष कासलीवाल डॉक्टर है और उसने बोला कि अकाउंटेंसी में प्रॉफिट ऐसे नहीं, ऐसे प्रॉफिट बुक होना चाहिए. कहाँ से आया? कौन भैया? जो मेरा फील्ड नहीं है, जो मेरे को आता नहीं है, मैं अपनी अक्ल लगा के कुछ भी बोल रहा हूँ. तो I have to be responsible for my words. अगर people are listening to me, so मैं responsible हूँ उसके लिए. अगर अमिताभ बच्चन कुछ बोलता है तो अमिताभ बच्चन is responsible for what he's saying. इसके लिए they have people around जो 50 बार पूरा स्क्रिप्ट करते हैं, सोचते हैं, then only they come and speak something out. They don't go and blabber anything because they know कि people are listening to them. But the new age influencers, उनके पास कोई backed up नहीं है. उनके पास कोई ऐसी टीम नहीं है जो कर रही है. They have become famous influencers, उनके millions में followers हैं, सब कुछ है, but the content is bad, unfortunately.
And do you ever think about this fact that with so many myths running around, about healthcare and just people getting influenced by all of this, what are some pillars that you personally hold and you advise to maybe your team, your patients, but your healthcare regimen is based around of, that you say that these 3 things I never compromise on, which make sure that my health is at my optimal according to me, so that common people who listen to this can also start implementing those?
See, मैं Medyseva के perspective से बात करता हूँ. So I started Medyseva with one objective, that I really don't want people, specifically in the rural area, to get influenced by quacks, the so-called Bengali doctors, and whatever. So what these people do is that one, they are not qualified doctors. They are prescribing medicines, which is allopathy. They are giving steroids to the patient, which is just not advisable. In the medical thing, where I come from, the allopathy, we are being trained to give steroids when none of the treatment works. And for them, it is the first abort of treatment. आप तो ये ले लो तबीयत ठीक हो जाएगी, अरे होएगी, स्टेरॉइड दोगे तो आपका बुखार एकदम ठीक हो ही जाएगा, बट अंदर कितना खराब है कर रहा है ये, वो अंदर आपको कितना खोखला कर रहा है, उसके आपके पेशेंट को अब इन्फॉर्मेशन नहीं है. तो पेशेंट स्टार्ट फीलिंग कि ये डॉक्टर साहब के हाथ में तो जादू है, क्या बढ़िया दवाई दी, एक बार में मैं ठीक हो गया. तो आप हो गए ही, बट अंदर बाद में आपको क्या हो रहा है वो आपको समझ में नहीं आ रहा है. The quality of the Indian patient is the worst across the world, one of the worst across the world.
Why?
One because वो लोग इतना स्टेरॉइड्स ले चुके होते हैं कि उनको नॉर्मल दवाइयां सूट नहीं करती है.
Okay, wow.
These people from the rural area come to the city to avail the treatment. उनको कोई मेडिसिन सूट नहीं करती, बिकॉज जो लास्ट अबॉर्ट होना चाहिए उन्होंने वो लेके सब लोगों को सारी दवाइयों की पोटेंसी को कम कर चुका है बॉडी में, वो असर ही नहीं करेंगे. So this is the thing which I am actually fighting for. I don't want the Ayurvedic, the homeopathy doctors to prescribe allopathy medicines. They should, because they have knowledge to prescribe their own pathy or to practice their own pathy. They should not practice allopathy for that matter. उससे आप सिर्फ लोगों का भला नहीं कर रहे हो, कुछ खराब ही कर रहे हो. But unfortunately पूरी कंट्री में ये सिचुएशन चल रही है. The homeopathy doctors are practicing allopathy. And I know so many people I have seen while traveling the rural places. I don't know you would have heard it or not. जो बच्चे ब्रीच होते हैं, ब्रीच बेबीज, यानी पता है क्या होता है, जो उल्टे पैदा होते हैं.
Okay.
पैर पहले बाहर आते हैं फिर सर आता है ना, उसको ब्रीच बेबीज बोलते हैं. सो ऐसी एक मिथ बनी हुई है कि अगर जो ब्रीच बच्चा जो उल्टा पैदा होता है वो पैर का अंगूठा किसी को लगा दे जिसकी पीठ में दर्द वगैरह होता है वो ठीक हो जाता है. ये बहुत बड़ा मिथ है, पूरे कंट्री में ये बहुत फॉलो होता है कि जो आप उल्टे पैदा हुए तो आप किसी को भी अंगूठा लगा दो तो पीठ का दर्द ठीक हो जाएगा. ठीक है, मे बी इट एक्ट्स एज अ प्लेसिबो और व्हाटएवर. तो आई हैव सीन पीपल इन द विलेजेस जहां पे लिखा हुआ है डॉक्टर सो एंड सो, पैर लगाने का समय सुबह 8 से 10, शाम को 6 से 7. आप डॉक्टर कैसे बन गए? आपने आपके नाम के आगे डॉक्टर लगाया तो लगाया कैसे?
That's crazy actually.
This is actually crazy. And these people, जब वो डॉक्टर आपने नाम के आगे लगा लिया, they start practicing medicine. They start giving you treatments. धीरे धीरे आप पैर लगाने से शुरू करके आज आप एक थैंकफुली सर्जरी नहीं कर रहे हो, क्योंकि वो आपको नहीं कर सकते हो. वो आपको नहीं समझेगा कैसे करना है. Otherwise you are prescribing treatment, you are giving injections, you are putting saline, all kind of nonsense is happening. और मेरी लड़ाई सिर्फ इसी चीजों से थी कि ये मेरे लिए ये इंपॉर्टेंट पिलर्स है कि कहाँ पे मैं स्टैंड करता हूँ और मैं इससे लड़ता ही रहूं. वेदर Medyseva works, Medyseva gets not on the floor eventually, I don't know, but this is the fight which I'll continue forever. मेरे असूल हैं, ये गलत है तो ये गलत है.
I think that's the stand, right? I think that's something, that's a noble pursuit. And you know, the last conversation that I was having, and it was with Guru Pashupati, and he was talking about how and he was talking about attaching yourself to a goal. And I think this really ties down to your personal identity as well, that now you've identified a goal which seems, you know, speaks so loudly to you that you are willing to pursue that to that extent of service. And I think that people like you and, you know, services like Medyseva are really the way forward if we are to bridge that gap between rural India and urban India. Essentially, why should we even, and you know, this happens a lot, right? People living in urban cities tend to disassociate themselves from the rural regions as if, you know, it's not a part of our own country almost. And the food that we are eating is coming from all of those rural regions. So I think that gap needs to be bridged. There needs to be a service platform for those regions and environments. And I think you're doing an amazing job in fighting that cause.
Thank you so much.
Yeah, I really wanted to commend you on this, because for some reason we are always driven by the factors of, you know, what seems the most attractive problem to solve, right? And not the problem that fundamentally solves anything. There are so many startups that are just trying to solve something attractive. a tech solution based to enhance your productivity by 5x. There are 100 apps on my phone that can help me make more productivity. I don't need another productivity app. But sometimes I feel things like these are difficult problems to solve, and that's why people don't get into them.
See, the kind of applications you were saying, that is also important in the world.
Yeah.
We cannot survive without our mobile phones and the kind of applications and whatever is coming into the market day on day. People are super intelligent and they understand that these are the problems of the urban people and they're trying to solve it out, which is very good. But unfortunately, the problems of the rural people are not being addressed the way it has to be or it should have been. Because they are not the ones जो ज़्यादा पैसा दे रहा है. So if they are not paying a lot of money, so they are not the kind of audience whom they actually want to work for. Yeah. So the problem is that they are not the one who are paying you a lot of money. They cannot pay a lot of money for the things which it is not a problem for them. उनके लिए वो प्रॉब्लम स्टेटमेंट ही नहीं है जो अर्बन लोगों के लिए प्रॉब्लम स्टेटमेंट है. सो एंड जितने भी एप्लीकेशंस इफ यू सी आर बीइंग मेड फॉर द अर्बन ऑडियंस. See the applications which are there on your phone. Try to analyze and realize that वो सारी की सारी problems, you are having those problems, but the rural people do not have those kind of problems. उनकी जो problems है उनको कोई address ही नहीं कर रहा. So I being a doctor myself, so I understand कि वहाँ पे कुछ problem है. Rural में healthcare related problems है. So it is a very, very difficult task to solve and resolve the complete healthcare problems in the rural area of our country. It is very difficult. But अगर मैं वो 4 जगह भी कर पा रहा हूँ, so I feel that I have done something good. मैंने उन लोगों की प्रॉब्लम तो सॉल्व करी. If not to the larger audience, say 90 crore of the population who living in the rural area, not to them, but if I am able to touch say 5 lakh people as well, तो भी मैंने कुछ तो अचीव किया.
Yeah, for sure.
Right. So just comparing with the applications and with the rural scenario. See, आजकल रूरल में भी लोग बहुत स्मार्टफोन यूज कर रहे हैं. They are also aware about internet. They are the one who are जो जितने हम इन्फ्लुएंसर्स की बात कर रहे थे तो उन्हीं के कारण इन्फ्लुएंसर्स की दुकान चल रही है. See, they are the because of YouTube. YouTube पे रूरल ऑडियंस ही है जो YouTube पे है. Right? So ऐसा नहीं है कि उन लोगों के लिए एप्लीकेशंस नहीं बन सकती. इट इज जस्ट यू हैव टू आइडेंटिफाई द प्रॉब्लम विच दे आर फेसिंग एंड ट्राई टू गेट थिंग्स इनटू देयर प्लेस, इनटू देयर पॉकेट्स. सो आई एम श्योर दैट वुड आल्सो वर्क रियली वेल.
I think, Dr. Vishesh, as we near the end of this conversation, and I, honestly enjoyed a lot talking so candidly to you. And I think, that is something which always is a good byproduct of conversations on this podcast. But I now want to put you on the spotlight, and I want to ask you I want to ask, what would you say if you were to make a reel and that goes viral? If I were to tell you, okay, this reel will hit 10 million views, and you have got 30 seconds to address something to general Indian public about their personal health and how they can improve it. So what would your pointers be?
See, वही सेम पॉइंटर्स हैं जो ज्यादा दूसरे डॉक्टर्स भी बोलते हैं. दे आर ईट गुड, डू एक्सरसाइज, फोकट की पंचायत नहीं करना चाहिए, अपने आप को पहले देखना चाहिए. So these are the only things which you actually should follow. Everything would work well if you are eating well and you are doing proper exercise. There is no problem. Balanced diet is the main thing. उस बैलेंस डाइट में फैट भी होना चाहिए, कार्ब्स भी होना चाहिए, प्रोटीन्स भी होना चाहिए, मिनरल्स भी होना चाहिए. एवरीथिंग शुड बी देयर. बट यू हैव टू थिंक कि क्या बैलेंस है आपके लिए. एंड इट वेरीज फ्रॉम प्लेस टू प्लेस. इट इज नॉट कि अगर मैं एमपी में रहता हूँ, यहाँ दाल बाटी खाते हैं, सो वो दिल्ली में बैठ के दाल बाटी नहीं खाया जा सकता क्योंकि एनवायरमेंटल चेंजेस भी होते हैं. सो उसका भी एक फैक्टर रखना पड़ेगा एंड समझना पड़ेगा कि कहाँ पे क्या चीज होती है. साउथ में राइस ज्यादा खाया जाता है, डोसा खाया जाता है वहाँ पे क्योंकि वीट लोगों को नहीं पचता है. उन लोगों की जेनेटिक इश्यूज हैं तो उनको वीट नहीं पचता, उनको राइस पचता है. हम लोग इतना राइस खाएंगे तो हमको नहीं पचेगा. सो दैट इज गुड फॉर देम, दिस इज गुड फॉर अस, सो वी हैव टू कीप दैट इन माइंड.
I think simple advice, effective advice. That is the whole point of this episode. But I love talking to you, Dr. Vishesh. Thank you so much for coming on the
It
Most
was a
Serious
pleasure,
Podcast.
Ripu. Thank you so much for having me here. It was great talking to you. मैं बहुत candid हो गया, मैंने बहुत लोगों की उतारी. So please try to cut it out.
No, I think this I would definitely cut out. This is the part which I want people to listen and hear to, and I always appreciate this candidness. Thank you so much.
Great. Thank you so much.